let's put 2 minutes on the clock and your time starts now. All right, time is up. Let's have a look at some of those answers. So this is one of those cases where either you know it or you don't know it. And I kind of threw this one in here, given we're just covering this kind of topic. Now, I've tried to make it also a little bit obvious, shall we say, so it's not going to scare too many people away. Of course, this is digoxin toxicity, and sure, early in the STEM it kind of throws out, oh, by the way, he takes digoxin. Always listen to those little hints they're trying to throw in. So we've got multiple hints in here. So we've got the nausea and fatigue, which is very common, particularly in early manifestations of digoxin toxicity due to the effects on the gastrointestinal system. We've got that intermittent confusion as well, which is the neurological toxicity of digoxin. You often get associated drowsiness and sometimes even hallucinations if it progresses far enough. We have our visual disturbances, which also includes that, the classic finding here is that yellow halo around things, sometimes green halos or sometimes just subtle blurred vision. And of course, we have skipped forward. There we go. Let's go back. And of course, we also have here the basal lung crackles, which this one's a little bit more subtle, but you can see with the direct cardiac toxicity, a more cardiotoxic profile and pulmonary congestion due to that heart failure. Now, if you're going to just kind of guess around a little bit, you'd still get some marks for guessing things like congestive cardiac failure or acute on chronic kidney disease. You're not going to be ticking that big box there. It's going to get you 3 marks as opposed to the others being only worth 1. Now, let's have a look as well at what our next question is. We'll put another 2 minutes on the clock, and your time starts now. All right, time is up. Let's have a look at some of those answers. And here we have to really pay attention to what is the actual qualifier in this question. So what is the most appropriate initial investigations to confirm the diagnosis? So a lot of these things you would do in a patient with digoxin toxicity, but what's the very first most important things you're going to do to really lock in, confirm that diagnosis and know what you're treating? Obviously, a serum digoxin level is going to come in pretty handy to do that, so definitely going to get marks for that one. Our renal function tests, so urea, creatinine, EGFR, yes, in practice, we're going to do those alongside things like our electrolytes, so there's a bit of overlap with F, but in the exam, you should be knowing which components of which tests you're looking for in particular, so sometimes expect to see these split up like this. So obviously the renal function test is going to be assessing our renal clearance, which is going to be a really important factor when assessing digoxin toxicity and has implications in terms of why this may have happened in the first place. Now, of course, serum potassium level is also going to be incredibly important because we're going to be looking at hypo or hyperkalemia, which can both come into play with digoxin toxicity as well as our overall cardiac function. Next up here, we have our chest x-ray. So while it's not specific to digoxin toxicity, it is actually a really valuable tool for excluding a lot of the other potential causes that we could be looking here. So would definitely be a very valuable first investigation, particularly when we have some of those chest findings there with the bilateral basal lung crackles. Of course, our 12-lead ECG, let's be honest, one of the main things we're all expecting to see here is those classic ECG changes which would suggest digoxin toxicity, and so while you're waiting for your serum level to come back, you could be grabbing that ECG, confirming the diagnosis straight away. Could that be a hint of things to come, potentially? Let's find out. We've got one more question here. Let's put 2 minutes on the clock, and your time starts now. All right, time is up. Let's have a look at some of the answers here. And for those who may be worried maybe the ECG was a little bit smaller than you would like, imagine what it's like when it's printed out on paper in the exam. Often they don't have the greatest scans available, so get used to practicing with perhaps sub-quality printouts. I think though, for those that know what they're looking for here, and hopefully you guys do, there are lots of very obvious findings here. Probably the most famous thing we're looking for, and the thing that's very well pointed out here, is this sloping of our ST segments. And then coming up, this is that slurring ST or Salvador Dali moustache sign. And for those of you who know who Salvador Dali is, yep, we're getting old. If you don't know, Google it quickly. You'll see it'll make a lot of sense. We also, of course, have our inverted or biphasic or flattened T waves. If you're putting any of those, all of those things can happen, often seen in multiple leads. And this is due to the digoxin toxicity. Here we've got a kind of combination of each of those findings, depending on which lead you're looking at. We also classically have our PR interval prolongation. This one, very difficult to see, admittedly. There are a couple of little hidden P waves around the place that if you're really paying attention, you will see them. Of course, we do know that things like atrial fibrillation are going to be associated with digoxin toxicity, which is why also if you are putting that, you're still going to get a mark. And there's arguably AF in this ECG here. There is that little bit of irregularity as well, but there are a few also hidden P waves that kind of steer away from that a little bit. We'll also see things like J-point depression. You don't quite hit that isoelectric line before going into your ST segments. And with that, you'll also see atrial fibrillation, as we've already mentioned there. Now, bradycardia for this question wouldn't actually get you a mark, even though it is one of the common findings with digoxin toxicity. Yes, if we look at the stem, they have 48 beats per minute. But if you actually count out this ECG, and what it's asking you is about this ECG in particular, this heart rate's much faster than that. We're in the kind of 90s odd, and so you wouldn't be getting a mark for the bradycardia mark there. And while we often see PVCs associated with this condition, we're not seeing any here, and so again, wouldn't get you those marks.